coming today and being willing to share your experience with us. I just wanted to ask you a few questions. Um, Before you started coming to SDI, what were some symptoms that you were experiencing and how did you feel?
I think the major reason that I thought I needed to go to someone who specialized in this was the weakness I was feeling. My body was tired all the time. Nights were sleepless because my body wouldn't shut down and it was very restless for me. Aches and pains, usually muscular pains, which couldn't be defined as to no other reason why it was. And having a background of nursing, I knew where it was coming from. I knew my sugars were uncontrolled. It was all over the place. There was no rhyme or rhythm as to where my blood sugars were. To begin with, I was a non-compliant patient, and I knew that I was non-compliant. With the job that I didn't have time to concentrate on me. And I think that was the biggest mistake. And as all nurses or all healthcare professionals do, first thing they do is avoid yourself and then take care of everybody else. And I think that was what was happening to me, and then my body was breaking down. Like I could feel in every cell in my body that that something was not right. And I knew other than diabetes, I didn't have anything else to blame. And my primary doctor just kept increasing on my Lantus at night, which would bring me down in the middle of the night, and I would be like hypoglycemic, and then in the morning I'll be like 300s and 400s. So it was like I was all over the chart. There was no control of my sugars. And I knew Dr. Cavalli from before. The first time that I was meeting with him was more with my thyroid problems. I had a goiter and I needed to adjust my medications with thyroid. That's where I first started to see him.
Okay.
And then when I was diagnosed with diabetes, I thought that was the best place to go back.
Okay. And were there some things that you were avoiding before when your diabetes was not controlled that you feel more comfortable with now?
Even though, as I said, I'm a nurse, I understand diabetes, I know what it was, and non-compliant with food, and avoiding medications, like at the time that you have to take. So if you have to take your insulin before you go to bed, I might take a nap and then come up and then take my insulin again. Like it was like in the middle of the night, I might be taking my Lantus, and that also had to do with different shifts that I work, and depends upon what shift I worked and I came home and what time I'm sleeping and what time I'm getting up. So the biggest thing was not watching what I'm eating. I didn't care what I ate. I always wanted the medicine to take care of what I ate rather than control my eating, and the medications to allow to adjust my body. I think once I came to Dr. Cavalli, he was the one who put the nutrition, the medication, and me together.
So you're saying that when you started to come to the SDI center, that they were starting to give you the tools that you needed
Yes.
to better manage your diabetes. What were some of the tools that they shared with you? You started to mention the nutrition part that was tough for you to follow.
Yeah, I think one of the first things that he did was he looked at all the medications and took away what was not needed. I mean, you talked about nearly 170 to 80 units of insulin per day plus my Lantus. That was like a huge amount of insulin I was taking, plus the oral hypoglycemics I was taking. So he looked at all that and he said, no, you're not going to take all this, and you're not going to. So he first started to adjust. He actually did the lab works and the blood works to start with, and then he started to understand me a little bit. I think about a couple of visits later, you put the continuous monitoring system to see, because I was still not giving him the readings that I wanted, not checking my blood sugar, and it took him a lot of time. I think it was a lot of patience from him, allowing me to understand everything and being a little more compliant and bringing the blood sugars. Nancy knows I never bring my monitor or my sugars back to him, and it had to do with my work too. I have a high responsibility job, so I never would stop to check my sugar or do what I needed to do. So he kind of worked with the labs a little bit, understood where I am, took my sugars, did everything in his capacity to make me understand that it was important for me. It was important that my body adjusts to the sugar. And it was, I would say, a holistic approach, because he was just not concentrating on the sugars, he was also concentrating on the other endocrinology system, like my thyroid, my pancreas, checked everything else out, my vitamins, my vitamin D levels, all that was affected by it. So it was a holistic approach. He just took a whole body study and said, okay, you need to adjust this is where your body pain is coming from, this is where your sugars are, if you don't do this, you're not going to do it. And my weights were way up. So, I had to control that. So eventually I think I started to understand what I call unnecessary calories and unnecessary carbs. I started to understand that. And if it's not necessary for my body, I stopped taking it. First of the things that he made me stop was taking Splenda. I was a huge fan of Splenda. I used to put Splenda in all my coffee, in my drinks, everything. And he said, for what? I said, drink it like that. He made it look like it's simple, just, So.
Can you show me your monitor? You said it's a continuous glucose.
To do with the police department wanting to donate.
Right. Fire department, everybody.
Yeah. Anyway. So
Annie, you were telling me that one of the tools you received here at SDI was the continuous glucose monitor. Could you show me that and explain it a little bit, how that works for you?
Continuous glucose monitor, this came out almost probably a year or so ago. It was approved for type 2 it was approved for type 1 diabetes a long time. I think for type 2 diabetes it just got approved. I'm not sure if all insurance covers. My insurance did cover it, and I know Medicare covers it 100%. And what I do is it's a sensor. So you put the sensor on, you change it every 10 days, and it's an AccuCheck machine just like everybody else's AccuCheck machine. You just bring it in front of it, it reads it without having to do a stick.
Okay.
So you're not sticking yourself 3 times or 4 times a day. And for me it was really bad because my fingertips were really getting sore, and I do a lot of writing and work with my hands. So it was really a problem having to do all those AccuChecks. And as I said, I was non-compliant. I would not stop to do it. Now the thing is, it's sitting right in front of me. I just do take it and put it again, so I get more readings than I ever did before. So it's an easy use. It is there. You can check your sugar at any time. Just don't need all the little needles to prick and then to dispose it, to get the blood all over the paperwork that you're working on. All that nonsense is gone.
Okay.
So I think it's more cheaper because there's not as much gadgets you're using as you would do with the pricking and the disposing of all the needles and the blood tinted materials, like the swabs and all. You have to throw it in the trash or whatever, and then you're spilling blood all over the place when you're doing it. So all that is gone.
Okay. Another thing that I'd like to ask, if you don't mind, you were talking about how much insulin you had to take, like it was a large amount of insulin and other oral medicines that you were taking. Now that you have been coming to SDI and your diabetes is better managed, have you noticed that there's cost savings?
Definitely. When I first started, I think each insulin of mine was like $125. I was on the U500. The co-payment was $125, and I used to freak out every month to come up with that kind of money. And there was a couple of other medications, and that's one thing I have to mention, that I was on U500, concentrated insulin, and once he put me through all the process, now I'm on a regular 100-unit insulin. So that's another big change that happened. They were trying to do the U500 only because I wouldn't have to use large amounts of insulin, like say 60, 50 units to put inside your body. With the U500, you just do the minimal amount of it. So that was a very costly medication, and my insurance had a high co-payments with that. So I don't have those payments now.
That's great. So that's helping you.
Yes.
Also financially.
Financially, it does help.
Okay. And then, how about with your work? You said that you have a very stressful, you have a lot of responsibilities on your job. How is that now that your diabetes is better managed?
Everything is so quick. As I said, I don't know if it's a year or more that I've been on the insulin pump. I don't have to stop. I don't have to go somewhere, hide myself to do a needle, pull the insulin. Even with the pen needles, it was never like convenient for me to find a space to go in and just give myself an insulin and go around with what I need to do. Now everything, because I wear my pump, like, you know, I can sit anywhere, check my sugar, and then just program my pump to give me the insulin that I need. So that's a very, it's not only convenience, it's, I think he recognizes what is individually needed for the person. Maybe as another person like me at my age wouldn't need an insulin pump and a monitor, but for me with my work and my lifestyle, I needed it. Like that was a rescue for me.
So with the doctor's support and with the tools that he gave you, you're better able to manage your diabetes so that you can live your life and do your work how it works for you.
And not have to tell the whole world that I'm diabetic. That's the dignity issue. Like before, if I go, and most of my job entails me to have meetings and lunch meetings, and I have to excuse myself to go do a sugar or take an insulin and then come back and join them with the lunch, or and that's when I become non-compliant, or in my head I'll think, oh, don't worry about it, I'll do it later. And that later never comes because you've already eaten your meal and then you're going to wait till dinner to take your insulin, and then your lunch is skipped. Right now I can sit under the table and nobody notices what I do, and it's so convenient that I don't have to miss taking my insulin. And even if I do, I have continuous insulin going into my body, which controls me much better. I don't see the 300s and 400s anymore.
Oh, great.
Yeah.
Great. So you really have been able to reduce your numbers. That's great. Now, you shared a lot with me about how coming to the center has helped change your lifestyle and helped you to live your life. Now, thinking back before when your diabetes was not managed, and now how you have it managed, are there some things about your future that are different? Like, do you have any goals or dreams that you look for in your future that you probably wouldn't have thought about before?
As I said, one of the most important thing is the amount of insulin, the amount of medication that is being put into your body has reduced. That's one thing that you have to give credit to the docs. You know, like most of the time people are adding medications to your regimen and saying, oh, you need for this, you need for that. Dr. Kawada has been very conservative in that sense. If it's not needed, he will reduce it. He will make sure that it is what you want. I used to have high lipids and high cholesterol and all that. He brought it down, and you know, now I'm in the minimum of the medications that I need to take. Said that it is important because before, when I used to plan to travel, I had to think about, oh my God, my insulin, my needles. I had like boxes of needles because you don't know how many you would need, how much to pack. Now it's easy for me to pack and travel. I can just get up and say, listen, I'm going somewhere. I don't have to worry about, do you have enough stock of this or enough stock of that? Because it's so much minimal things that I need. Everything is in me, is on me, and I just can walk out and leave and go. In the future, I would see, and it's. I think the insurance companies that have to work with us is, for now, the continuous glucose monitoring and the insulin pump together. There's a programming that's only for type 1 diabetes. I would hope to see that happen in type 2 diabetes, and I don't have to do this checking and then program. I would want to see my insulin pump, check my sugar, and do the program. So if that happens in the future, that's something I look forward to, and I hope the insurance companies will work with us for that.
Okay, and you find that's really working well for you to have.
Yes.
To have the continuous monitoring of the pump.
And I think, I don't know why the insurance companies don't look at the way, because everything is so controlled with the insulin. That takes away a lot of my problems, like, my aches and pains and not wanting to go to work or not wanting to do things. Now I want to do things. I want to be where I want to be or do things and be with the family. And before, every time I was looking for a little nap time and lay down, or I don't want to do, you guys go do it, I'll be fine, I'll stay home, kind of a thing. I do a lot of things with the kids and family.
Great. So it's really improved your whole lifestyle, not just your work or your physical health, but also your relationships with your family and friends, being more present with them and able to do some more fun things? Do you have any trips planned?
I just had a trip. I had a whole month in India.
Oh.
Yeah, and I was not even worried, except for my little insulin bottle. I didn't have to, pack a lot of things. I just don't have to worry about. And especially when you're in those countries, my biggest problem is where do I throw these needles? Over here, I have disposable stuff that I can throw, and I exactly know where to throw it at my work or where. Back in India, I wouldn't know where to put them away or how to.
Okay.
So that does help a lot because most of the system that I have is needleless. So.
Mm-hmm.
That helps a lot. The thing is, it has improved my sleeping pattern. I used to take melatonin to go to sleep. I used to take Tylenol PMs and Motrin PMs, Advil PMs. I don't take any of those to go to sleep because once your body has settled, your body knows and your sugars are controlled, sleep comes to you normally. It doesn't have to be forced. Before, when your body didn't adjust, I had to force myself to sleep, which I don't have to do.
So you feel like your life is just more natural overall?
Yes. I can lay down. I can go anytime at 8:30. I can go lay down. In 10 minutes, I'll fall asleep. If you look at his notes, you probably will have tons of notes where I complain to him, I cannot sleep, I cannot sleep, I cannot. That's gone away. I can be anytime, come home and just lay down and I can go. I don't have to look at my melatonin anymore. I don't have to take a Tylenol PM anymore. And I personally believe it is because my sugars are adjusted. And my other hormones, because he does look at my thyroids were off the chart and my vitamin Ds were out of the chart. So he has brought all that into a little bit of normalcy. So
you feel great overall. And you look great too.
Thank you.
Yeah. You look happy.
I am. Yes.
Good. Let's see. Do you have any future plans, like fitness-wise?
I do a little bit of exercise at work. I have a half an hour exercise program on a Monday to Friday basis, which I continue to do. Other than that, I feel content with my body. I do work a lot, so most of my day goes working, and then when I get home, it's work at home. And I mean, it's not that I sit idly. I do walk around and do. One of the changes I do make in lifestyle, I don't take elevators. I do stairs most of my days, up and down. So park my car the longest distance and walk to work. So those little adjustments, as I said, I think one of the biggest problem was using all these diet supplements like the Splenda and all the other diet drinks and stuff like that. He discourages you to use it, so it helps. Somebody has to tell you not to do it. If they don't tell you, you just think it's normal and just keep doing it. So he emphasizes on it, looks at your weight and why you're up, why you're down. He'll get to you.
Let's see.
I think the other biggest thing is he puts so much effort, and this is personally I'm talking, is he takes so much effort into knowing you that when you come back you want to do something for him. You want to give him a change. You want to make sure that his efforts are not worthless. I think that makes a difference.
That personal touch and really knowing you as a whole person and not just a number. Compared to 3 years ago, do you think you'll travel more than you have in the past?
I do travel a lot, but I used to travel with a lot of headache, like, oh my God, where is my insulin, where's my pump, where is this and that. Sometimes I've traveled where I've like 2 more strips left in my bag and I forgot to take another bottle of my strips. It's so much easier now. It's like, you know exactly what you need and what you want. This gets changed every 10 days. So if I'm just traveling for 3 days, I don't want to worry about taking another pack with me. I know what my insulin is needed. I change every 3 days, so I know what I need for that 3 days change. So I think it's more, you don't have to think a lot about packing when you're traveling. I do travel a lot, make short trips and work related and more kind of business related trips.
But it takes a lot of that stress off.
Yes.
That's good. That's great. Was there anything else that you'd like to share?
I think his focus is good on his diabetes and patients. I do recommend a lot of my staff, especially on this monitor, because I see a lot of people at work struggling I know a lot of people struggling with diabetes, and now that I have come to this stage, I feel it's such an unnecessary struggle. You can fix it. There is hope. There is something you can do about it. And like any other things in the world right now, everybody is looking for an easy fix, an easy way to work with it. And one of the most difficult part with diabetes is, as I said, knowing to take your insulin when and how, finding the time to take it, finding the place to take it. Now all these conveniences that is available, just want to make sure people take advantage of it. And you just can't get this by just going to your primary doctor. You have to have, because there is a combination of your specialist, the labs, the dietitian, a person like Nancy who has to promote to make sure you do what he's saying to do. She follows up with everything. I mean, he recommends, but Nancy's the one who follows up to make sure, they made the appointment. I went to whatever I was supposed to do. Sometimes I'm fearful that for Nancy's call, did you do it? And I'm like, so it stays in your head that you have to. Before I never cared because there was nobody to follow up on it. So if I didn't go for an appointment, nobody was calling me and asking me, why did you make that appointment?
So you get a lot of extra support
Yes.
here at SDI than you would have before.
Yes.
And because of that extra support, it helps you to stay on track.
Because it's easy for you to get out of here and forget about what needed to be done. Because everybody works, once you get into your work, you're in the work mode. You're not thinking of here. But sometimes that one call is what is needed. Oh, I didn't make that appointment. Let me just make it. Even that recent one appointment when I got canceled, totally the next day I came from my trip, I totally forgot about making it until she called me and I'm like, oh, I didn't make that appointment. And right away I sat there and made the appointment.
So even though someone could have a chronic condition like diabetes, with good support and the tools that you need to manage it, you can still live a happy, fulfilling, and fun-filled life.
Yes. And one thing that people forget is diabetes has a lot of complications. You just come to Dr. Kavale one time, he'll tell you about those complications. And then from there, you don't want to be there. Once you hear what he has to say, you don't want to be on dialysis. You don't want an amputated leg. Those are things that's the truth of life if it's not controlled. So you need a group of people to keep you on track. And I'm sure this helps a lot of people, family, insurance company, and the state and the country.
Well, thank you, Annie. Thank you for taking the time to share and
Thank
be
you.
open with your experience.
Thank you for having me. Yes.